Hello, everyone. Welcome to the Women Are Worthy Wednesday. Ooh, Women Are Worthy Wednesday. Welcome to the Women Are Worthy Network on
Okay.
Tuesday. Tuesday is Thank You Tuesday, Thankful Tuesday. And guess what, y'all? I've been waiting to get this lady on this show. When I'm talking about she's a bad boss lady, and bad as in good. So the Women Are Worthy Network, we welcome Miss Kelly Johnson. She currently serves as the director. I want y'all to listen to me. Listen to the title. She serves as the Director of Human Resources for the Georgia Department of Community Health. This states, okay, 60, this is 16 billion. I didn't say thousand, I didn't say million. It's a 16 billion agency responsible primarily for the administration of Medicaid and the state health benefit plan. Try saying that 10 times. And the oversight of healthcare facilities. So the Women Are Worthy, the network and the Women Are Worthy show proudly. We are so honored to have Miss Kelly Johnson. Hello, Miss Johnson.
Hello. It's good to be here. Thank you for having me.
Oh my goodness. I feel like I'm in the presence of celebrity, okay? I feel like I'm in the presence of a celebrity. We also, I want to get rid of, I want to start doing some general housekeeping. If you want to join our tribe, our Women Are Worthy Network tribe, you must subscribe. Yep, I came up with that. You can't take it because I trademarked it, okay? So please make sure that you subscribe to our network, the Women Are Worthy Network, where we have women and men that come on the show that are doing phenomenal things that we just want to shine a light on what they're doing. So, Miss Johnson, can you please tell us who is Kelly Johnson?
Let's see. Kelly Johnson is a Christian, a wife, a mother, and a director. And I do my best to maneuver all of those roles and responsibilities throughout my daily life. But I think I'm on the show related to my primary responsibility at work, which is a director, which I love. I am an HR passion field person, and my motto, even with my team, is dedicated to keeping the human in human resources. And so my responsibility includes managing the most important resource of any organization, which is the people. Because without the people, you can't get the work done. And so that who is Kelly Johnson.
Well, thank you. So for some out there, they're not sure, what is the Department of Community Health? What is community health? You can clarify that for us.
Okay. And so our agency is responsible for the administration of Medicaid, from pregnant women to infants and children, and then the adult disabled population. And then there's another category of Katie Beckett Medicaid, depending on the qualifications. Our agency is responsible with implementing and oversight of that program's administration and maintaining eligibility and managing the CMOs, which are the organizations that individuals can receive Medicaid through. We are also the agency responsible for healthcare facility regulation. And so when you think about all of your medical facilities, such as dialysis or long-term care facilities, our agency is responsible for surveying those facilities to ensure that they are following federal guidelines. And go ahead.
Is that just ancillaries or all facilities?
All medical facilities are responsible, that have direct responsibility under federal guidelines for the Centers for Medicare and Medicaid. And so it could be your private nursing, private care homes, or medical facilities, dialysis clinics. Then our surveyors, who are nurses and some non-nurses, will go out and survey and recertify those facilities to ensure that they're following guidelines. In addition to that, health planning. And so any specialty services within hospitals or facilities, then they coordinate through our agency to make sure that they have meet the requirements to operate and maintain their operations, and as well as the state health benefit plan, which you mentioned. So 680,000 state employees, retirees, and teachers. Health insurance, self-funded health plan is maintained by our agency as well.
I don't like to say led down. So what led you up to the path of being a director or at least working for community health?
I am a 21-year state employee, and I began my career back at the merit system and in HR. And so I spent all of my career with the state in HR. And I started at an entry level position and just worked my way up to three different agencies. And now I'm at the Department of Community Health and building my own team, my own legacy, and building a brand that supports the agency's mission and goals.
I want you to repeat. There's something that you said that was so important that I want people to hear. When you said you started where? When you started the company?
Entry level, and work my way up. And so I did complete bachelor's degree. I'm a Spelman alum. I went to Kennesaw State University and received my master's in public administration. But sometimes, it's necessary to get the experience. And I went in and worked my way up within couple of years. Every couple of years, I kind of moved up throughout the organizations, and that resulted in me taking different opportunities at other offices. But right now, I am currently the director and have been here 5 years with the Department of Community Health.
I know you have several pivotal moments, but with people, can you name at least two that you've had that really affected you and you still think about it to this day, whether it's a win, whether it's for the team? Because I can just see so many things that you're impacting so many lives, whether it could be a phone call, it could be a letter, anything.
I think that some of the biggest impactful moments for me is when I am able to see individuals who are on my team be promoted up and out of my office. And sometimes that's hard for people to see. But sometimes, you can inspire others to be great somewhere else. And knowing that I had a part in that makes the journey worthwhile. I want a team full of individuals, one, who love HR, but two, have the capabilities to go anywhere, but they choose to stay with me and work because of the environment. And so I am committed to creating a place that I would want for myself. And so I have an awesome team of individuals who I enjoy working with, and so the give back for me is seeing the individuals develop and move up to bigger and better things. And then one of the other funny moments is when I had my son said to me when he was younger that all I do is listen to people complain because HR deal with a lot of employee relations, and he wrote a paper in the school, and he talked about how my mom, she just listens to everybody complain and no one listens to her. And for me, he was tuned into what I was doing, and to see him evolve now into a young man to understand the true nature of HR and why I was doing what I was doing. That was a pivotal moment for me because he realized he thought I just sat at work and talked to people all day. That's what he would say, but now he understands the true role of HR office and the value that they can have.
You're a wife, you're a mother, you're a teacher. And when I meant teacher, because your children and your team, you're doing a lot. So my question to you is, what are you doing for self-care?
Well, I do like to walk in the evenings. I'm a member of a gym, and since we've been teleworking, I've been able to run out for lunch and go and have some quiet time. But I'm an avid reader, and so in the mornings I get up a little early, and I just like to be still and read, whether it's from the Word of God or a good book. I do just like to sit still and quiet, and of course, vacation. I believe in work-life balance. I like to encourage my team because the work is going to always be here. But, and so you need to take that opportunity to celebrate life, celebrate your family, and celebrate accomplishments. So I do like the vacation. I do like to travel when we're not in COVID. And so I do take advantage of spending time with my family as a way to relax and to check out.
Well, I want you to look directly in the camera because I'm duplicating you and I'm bringing you with me, okay? Because it's so refreshing. And this is what I found during COVID, that employers are really seeing the value of the employees, where they want the work-life balance, where, maybe in the past it was just work, 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 but they're taking that extra. And I can tell from you, it's something you've always done. But I'm seeing with other employers, they're telling me this, that, because of COVID, now I'm actually looking at them not just as a number or doing work. I'm looking at them as a human being and as a person. So I'm glad that you're doing that. I mean, that's so amazing to see. You're a kick butt lady. You are just, you're definitely a worthy woman, most definitely.
Well, I appreciate it. And I tell managers that I talk with all the time who may have concerns or are reaching out for assistance with an employee that people bring their whole self to work. They don't bring just their work self. They bring their whole self with their whole family and their whole concerns. And so we need to make sure that we're equipped to handle the whole employee. And so work-life balance, mental health is very important to address.
And I want to explain and bring this out there because I'm all about greetings, Chris. I'm all about mentoring and empowering. And my question to you is, do you have a mentor?
I do have a mentor. I've had a mentor for many years, and somebody a sounding board, somebody that you can bounce ideas off of, or even when you're just frustrated, and not you want to replay a situation or a scenario. They, challenge me to be better than I think I can be, and then somebody be real honest. Hey, Kelly, you didn't do that right. You might want to think about handling it this way. And so it's not just somebody who is going to say, yeah, you got it, but somebody saying, I don't know, that might not be the right direction. And so I believe in the value of a mentor to help not only just empower you, but to help instill confidence and guidance in the direction that you really want to go in.
And I want to mention that I met you. Well, I heard that you were going to be on the Monday mentoring, and I thought it was just phenomenal because I'm telling you, I was going through these rooms, shutting. Oh, I hope they're not listening. Shutting down my computer because after a certain amount of minutes you can't get back in. Shutting down my computer because I couldn't get you. Okay, so for you that are watching, I'm sorry, but I was trying to get to Kelly. I was like the rooms, but I was trying to get to Kelly. So I shut down my computer and call and say, I'm having computer issues. I don't know what's going on. So I can get back in the room. Doggone it, not Kelly. I'm going to reach out to her because, HR has come a long way. And my question that I want to ask you is, let's say, President Biden watching the show as he should and says, you know what? I'm liking this Kelly Johnson. I'm really liking her. Let's see if we can find $3 million in the budget, give it to her so she can administer this towards the Georgia Department of Community Health. What 3 things would you like to work on? In your HR department. So I get that. So whatever.
Solely on the HR department?
No, it's your money for the company. You can do whatever you want to do with it as long as it stays in the Georgia Department of Community Health.
I would probably invest it in the people. And so I would enhance or bring additional opportunities for training and development, things that may be out of our budget just based on need. I would use it to help support and fill vacancies, retention, and then maybe just engagement. Engagement is important. I want people to feel engaged at work. And so I would probably work with the engagement team to think about how to utilize the resources to get stronger buy-in and to support technological needs within the organization.
Kelly, why do you think it's important that women support each other?
Wow. Because we need each other, because we can help support, encourage, motivate, mentor, shape, guide future leaders. And so I think that women supporting women are necessary for success. And it's not a competition because I think that we all can get there together. And so I encourage my colleagues and my coworkers to reach out and help one another, especially when we're in need. Especially women, we are a unique creature in and of itself. We take on a lot, we try to achieve a lot, and so support sometimes is necessary and needed.
And I think because too, sometimes as women, we hit a glass ceiling. And I want to ask you, what can we do to support you or other women who are at that level that they can get to the next level, but they need help? What needs to be done? Because you're there, and sometimes it takes a lot to stay there. So, what advice would you give people, women out there and men that are listening?
So one of the things about HR, sometimes HR is seen as administrative, and we want HR to have a seat at the table, to be strategic, to be a true partner in the organization because we are managing the people resource. And so one of the things that we can do is to ensure we show value, and showing value could be through things that you analyze or showing how you could assist in achieving a mission. But for somebody who is not at the table, then how do you get there? You have to figure out that inner workings of that office, find a mentor in the C-suite, talk to somebody who is already there or who can encourage and develop, and then really put it out there. Hey, what do I need to do to grow my career? And so sometimes I realize I need to make sure that one, I'm knowledgeable about the agency. Having a seat at the table is really understanding the big picture. What does the agency need? So when I'm at the table and they're making decisions, that I can really have a value added to the conversation, and it's just not based on people. I want my opinion and my thoughts to matter, and to do that, you have to be considerate, you have to be deliberate, you have to be purposeful, and then most importantly, you have to be, show that what you bring to the table. I like to say we measure what matters from an HR perspective, and so how do I use my measurements, my data to support what the agency needs, and how do I give back to the organization by just um, by showing them what we can offer from an HR perspective for the betterment of the agency.
What are the two, if you can think of, what are the two most common misconceptions that people have about HR? Because I'm going to tell you something. When I was in corporate America, I mean, and just listening to you and all my other friends just talking, listening to you, I'm telling you, I'm going to say this, and I like giving people their roses because you don't want to wait till they get sick to give them the roses.
Mm.
I've just met you, and I want you to know that. Oh my goodness! It just sounds like heaven working in your department. Because what I'm saying is nothing's perfect, but what I'm hearing is you are treating your team, not employees, your team, not just like their family, but basically on an individualist basis. And you're hearing what they're saying. You've been there because you've actually rolled up your sleeves and you know what it's like. So nobody can tell you, well, this can't be done, that can't be done. And that's what's great about you because you've done it. So you've been in the fields, you've been out there on the streets, so to speak. So you know how it's ran. So they can't pull the wool over your eyes because you know how it's done.
Agree.
So what are the most common misconceptions people have about HR? The two most common misconceptions.
The two most common, that we're the police. Is like, I'm with Big Brother and we're gonna come in and I'm going to tell HR, and that's one of the biggest misconceptions. And two, that we're only paper pushers. We just here to process your paperwork so you can get your check. And for me, I like to demonstrate that we're more than that. We're a true business partner in the organization, a necessary arm in order to accomplish your goals. And so without the people, you can't get any of your mission or your visions accomplished. And so let me show you how you can empower the people so that they can fulfill your mission. And so to do that, you have to invest. You have to invest in the people. You have to invest in resources for the people. You have to develop the people. And so that's why I say keeping the human and human resources is very important for us.
So, what did you do when you were told you are the director of human resources for the Georgia Department of Health? What did you? How did you celebrate that?
Um, I don't even remember what did I probably called my husband first when I first found out. But two, I started thinking about what I was going to do. What legacy did I want to leave? What when people say Kelly Johnson, what did I want them to remember me for? Even if it was 1 year or 20 years, what do I want to be known for? And so I just wanted to be somebody who made a true impact to support the agency's goals and missions. And so I've loved every minute. I mean, it hadn't always been good, but
Mhm, mhm.
I can truly say that the journey is part of the success. Getting to where I am now has been well worth the journey. And I continue to strive to be better, to do better, and to better support the agency.
Well, you're doing it, okay? You are doing it. So that leads me to my next question. It's parts. Where do you see Kelly Johnson in 5 years? And where do you see community health in 5 years?
Wow. So Kelly Johnson in 5 years. Um, Ideally, I would still be in a director role, whether it's with community health or another organization. Um, I'm not sure, but I do still see myself in a leadership role, and preferably with community health or another state agency. And then the next 5 years, I see community health being more adaptive to the changing needs of the state. And so streamlining processes and responding adequately to the Medicaid needs for the agency, as well as the population of Georgia. We touch 1 in 4 Georgians a day. And so I like to say that community health will continue to strive to do that. And so ensuring that we have succession planning in place, that's what we're focusing on. So how do we build our next leaders for the organization? So in the next 5 years, we have talent in-house ready to take and lead us into the next century.
You're fascinating. You are. What can we do to support your efforts and your mission and your goals and what you're doing? We as people, we people of Georgia.
Um, so I guess our services are directly related to specific needs and areas. And so citizens of Georgia who are receiving services, if there are things that we can do better or improve, I encourage them to let us know. Um, to um, to also let the team know when they are performing well. Sometimes that helps, or when something has gone the way they expected. And so if there's a better way, I'm sure the team is would welcome any opportunity to try to advance and further meet needs. And then we are always hiring. We need nurses, and so if there are any nurses out there looking for a way to give back to the community and support the mission that is not direct patient care, we're always looking for individuals to help support the mission of providing health care to 1 in 4 Georgians. And so I just encourage the community to understand that we are agency, that we are human, that we're doing our best to meet the needs.
So, what? How do you personally give back? Because I believe that when you're a leader and you have people following you, because I know you do a lot of things, but how do you personally give back to the community?
That's several different things. One, um, I mentor 3 different individuals in their various roles and careers. I do partner.
That was a hint. Okay, I'm gonna let you go. Sorry. Okay.
I do partner with a couple of colleges and their career services to talk about being ready to go into the workforce. And so that is my biggest gift back and my biggest fulfillment. And resume writing. I do assist with individuals helping with their resumes. I get a lot of contact on LinkedIn and I try to address those because I know I was once in their shoes and want somebody to help me if I can. And then I am very active within my own church community and have a lot of give back in that arena as well. But professionally, I am dedicated to developing our next leaders, whether that be in HR or another field, and just really being honest with our young career seekers on what they need to do to move to the next level of their career.
When do you know, have you ever had that moment where you said, man, that was a job well done between my team, between the team, myself, job well done. When did you, what moment was that and when did you have it?
I still have those, I think. I think sometimes you can come up with a plan or a goal, and the team can be creative and outshine even your biggest dream of how that was going to be impacted. And so sometimes we demand so much of our team that they can exceed some of those expectations. And you sit back and you're like, I cannot believe we pulled all this off, and sit back and smile. And I don't know how many times I can say how appreciative I am of the team that I have and the support that I am afforded because of them and the work that they do every day and the sacrifices that they make. And so I'm truly blessed in that regard. And so I try to thank my team as often as I can, because even with COVID, they have had to maneuver. If you'd have told me we've been doing contact tracing as part of a daily responsibility with exposure to COVID, I wouldn't have believed you. But it's a regular occurrence for us in our current roles and ensuring the safety of our workforce.
Oh, wow. So it's your team that does that?
No, ma'am. No, I'm talking about, no, that's Department of Public Health. I'm talking about for our own internal staff.
Okay. Okay.
Yes, I mean, and
Wow.
so most HR offices have to handle that responsibility. And so when there's exposure within our own agency or teams, then we are responsible for maneuvering that and making sure that we notify individuals who could be exposed or at risk.
So if there's someone out there who wants to give, just say, oh my goodness, I just love what they're doing. And because this is what I talk about, that people are so quick to complain. They're
Agreed.
not quick to compliment.
Agreed.
And I'm all about complimenting people because you don't know if you give someone a good word, you may be changing their entire destiny because you don't know what people are going through. So I want people to know if they've had positive experience with your organization, what website, whether they should put it, because I'm telling you, talking to other people and hearing about community health, look, word on the street is y'all doing a good job. Word on the street. So, and that's a testament to you and your team, but it really starts from the leader, because if you're not leading well, the team is not going to do well. So the fact that you're an example of what the team is, you're the epitome of, we're family. And so I'm just here to tell you on what I'm hearing, because I just like when I'm talking, I check things out, and you're just a good, not just a great boss from what I'm hearing, you are a good person. So how can one reach out to the organization to say they've had positive experiences? And because sometimes the team needs to know good feedback, not just from their manager or director, from the people who they're helping.
Agreed. There is the Department of Community Health is located on the website.
Okay.
dch.georgia.gov is the current website. We are on LinkedIn as well as, I can't think of the other one. Facebook.
I'll find it.
Okay. Okay. And so people are more than welcome to reach out, but by no means. My role is important, but we have a great executive leadership team that is at the helm and trying to make sure that the agency is pushing forth in the right direction. And, I fully support the mission and the vision that they have outlined for us to follow. And I am grateful for being a member of the team, and being challenged to meet some of the demands that we are faced right now in this environment.
You know, it's early and we want to make sure, because I heard you talk about work-life balance. So take you away from your family all night. So the Women Are Worthy show, we, on the network, we really want to appreciate you being here. We appreciate you sharing your wisdom, your knowledge, and for us to understand. Notice I put all that together. And, because we may have some youngins. I call anyone under 30, I call them youngins.
Okay.
People over 30, I call them not seniors, but seasoned.
Okay.
So they may, we want them to understand. And plus, my interns and mentees, we want them to see that anything is possible.
Agreed.
So when you walk into whatever company and you may think like, I'm above doing X, Y, and Z, you need to know the mechanics. You need to know how an organization, how it's grown, how it's operated before you think about, I want to sit in an executive seat. And you're the prime example of, you started from the beginning, because I don't like started from the bottom. You started from the beginning, the very beginning, and now you're here where you are. So we so appreciate you. We thank you for taking the time with us. Miss Kelly Johnson, I'm pretty sure we're going to see and hear more about you. You are my social media now. So if anything pops up with you, I get it. Okay.
Right,
and if there's anything you need us to post, any things that you're doing, or regarding the organization, let us know, and we'll post it. We'll put it out there, and we'll talk about workers and things like that. But I am so proud of what you're doing. I love what women are doing. Because we're all about diversity on our show. It doesn't matter who you are, as long as you're positive. Because I'm personally allergic to negativity. I break out in hives. So we're all about positive people who do great things. So we want to thank you. We send you blessing, prosperity, and much abundance between you and your family and your department that you're working with. Thank you.
Thank you. I appreciate it.
You're welcome.
Pleasure to be here.
You're welcome.